If your back pain is worse when you bend backwards, if it's a deep ache on either side of your spine, not down your leg, if it's worse first thing in the morning and worse after you've been sitting for a while, and if your MRI looks more or less normal or shows changes that don't actually match how bad you actually feel, there's a good chance your pain is coming from your facet joints. I'm Dr. Ingle, a consultant in pain medicine, and facet joint pain is one of the most common causes of chronic back pain and one of the most commonly missed. Your facet joints are small joints at the back of your spine. There are two at every level, one on each side. They let you bend, twist, stabilize as you move. And like any joint in the body, they wear out. They get arthritic, the cartilage thins, the capsule becomes inflamed, and the nerves that supply them, small nerves called medial branch nerves, start sending a constant pain signal. Around 1 in 3 cases of chronic low back pain comes from the facet joints, possibly more. The reason it gets missed so often is that it doesn't always show clearly on standard imaging. An MRI may show some wear and tear, or it may show very little. The pain doesn't always correlate with what the scan looks like, but the pattern of pain is recognizable. Worse with extension, bending backwards, better with flexion, that is leaning forwards. Local, either side of the spine. Often morning stiffness, pain after standing for a while or after a long drive. If that pattern fits you, the next step is a diagnostic test called medial branch nerve block. Here's how it works. The medial branch nerves carry pain signal from the facet joints. We numb these nerves temporarily with a small targeted injection guided by an X-ray, so we can see exactly where we are. If your back pain is coming from the facet joint, that injection will give you several hours of significant pain relief. If it doesn't, we know the facet joint aren't the source and we look elsewhere. If the diagnostic block confirms facet joint pain, the next step is a longer acting treatment called radiofrequency denervation, sometimes shortened to RFA. Here's what it does. We use a fine needle that delivers controlled heat to medial branch nerves, the same nerves the diagnostic block numbed. This heat interrupts those nerves so they can't send pain signals. The procedure takes around 45 minutes. It's done with local anesthetic. You go home the same day. Many patients experience a significant reduction in back pain, often for 9 to 18 months. The nerves do regenerate eventually, which is why the treatment isn't permanent, but it's repeatable. If your pain comes back, the procedure can be repeated. For patients with facet joint pain, this two-step pathway, diagnostic block first, and then the therapeutic denervation, is the standard of care in interventional pain medicine. If your back pain matches the pattern, the link to book a consultation is on this page.